Do you struggle with really bad period pain or really heavy periods, heavy bleeding? Welcome to Well Jawn Wednesdays. It's Coach Ty, and I am back for another episode where I get to talk about real wellness for the real you. So today's episode is for my ladies out there. It is GYN related. The last time we spoke, it was more for men and women. We spoke about heart disease and high blood pressure. Hopefully you all got your blood pressure checked. You went to your doctor. You really took time to evaluate if you struggle with headaches, and saw or was able to see if that was a possibility because of high blood pressure. If not, I still want to encourage y'all. February was Heart Health Month. We're in March now. But I still want you all to be very, very conscious of your blood pressure and your cholesterol. So yes, we are in a new month. We are in March. And I don't know if you knew that March is Endometriosis Awareness Month. Okay, Endometriosis Awareness Month. And we're going to get into what endometriosis is. We're going to talk about the symptoms, the risk factors, some of the treatment for it. But before we get into that, I do want us to talk about some wellness wisdom of the week. Okay, so for today's episode, my wellness wisdom is that you have to listen to your body. And if something does not feel right or normal, you should definitely talk to your doctor and advocate for yourself. Okay, I know sometimes when we go to the doctor, we may tell them our symptoms, and a lot of times our symptoms can be downplayed. It could be, oh, well, it's not that bad, or, oh, that's normal. But we know when something isn't right, and we really have to find physicians or providers, not just physicians, because we have amazing nurse practitioners out there who will really sit down and let us talk about what we're going through and try their best to figure out what's going on, as opposed to just writing it off for something that they think it is when it could be exactly what you thought it was. So I just want us as women to advocate for ourselves, because a lot of times we're told to push through the pain. But if you're having chronic pain, which is pain over a prolonged period of time, you took the medicine, you did the test, and it's still not going away, then something is going on. And again, we need to find providers that will listen to us and really make it their priority to solve the problem. So the key takeaway for today's wellness wisdom of the week is to advocate for yourself, trust your body, and don't settle for, oh, it's not that bad or it's in your head. No, that's not good enough. So now we are going to get into endometriosis. And this is something, as I shared with you all, for me, I've been an OB/GYN nurse for a very long time. So there's a lot of these GYN conditions that I have been exposed to through patients coming in, or women in this case coming in and saying, hey, my period is just, I bleed very, very heavy. Or I get really, really bad pain in my period. Now, of course, we know menstrual cramps are normal, but when it comes to endometriosis and even fibroids, which we will touch on another episode, that pain and that bleeding is intense. Okay, so those are some symptoms that it could be a few different things, but now for today's episode, we're going to talk about endometriosis. Okay, so what is endometriosis? Endometriosis is a condition where tissue that is similar to the lining of the uterus, which is called the endometrium, it grows outside of it. So this tissue can grow on the ovaries, fallopian tubes, and even other areas in your pelvis. This tissue can grow anywhere. Okay, so because of this tissue growing in places where it's not supposed to, this can give you the chronic pain. It can give you a lot of inflammation, and even in some cases, infertility, meaning some women can't even get pregnant because this tissue is just growing in places where it doesn't belong. Okay, so just to repeat that, endometriosis is a condition where the tissue similar to the endometrium, it grows in other places that is not supposed to grow in. And it does take women it takes them about 7 to 10 years to get a proper diagnosis. Can you imagine for 7 to 10 years, you have heavy bleeding, you have really bad period pain, and you're just dealing with it because you think, or maybe a doctor is saying, oh, that's just cramps, or that's just, you just have a heavy period, no big deal. Like that's not right. That's not good at all. 7 to 10 years is a long time. So please pay attention, make some or write some notes rather, because I want you, if you struggle with heavy periods, if you struggle with heavy bleeding, a lot of pain, and just you feel like something is not right, I want this to be something that you maybe think, okay, maybe I should get evaluated for endometriosis. So what are the risk factors of it? Like what can lead to us getting endometriosis? So there's not really a cause of it. Like it's not anything you can do that will make you have it. It's just something that could be in your family. So family history is a risk factor. Like if you have a mom or sister or grandmom, if they've always struggled with it, you may be more likely to have it. If you started periods, you're having your periods at a very early age. If you already have heavy or long menstrual cycles, if you've never given birth before, and sometimes if you have an autoimmune condition, that can make you at a higher risk of getting it. But again, these are just things that they're like all speculation, okay? Because there's some women who may not have had anybody in their family with it. They may have not gotten their period at an early age. They may have regular or thought they had regular cycles, or maybe they have children, or, they still get it. So I don't want us to think, oh, this is definitely how I'm going to get it or why I'm going to get it. No, it can just happen. And unfortunately, we may not always know the reason. Okay. But we do have certain risk factors. So what are some symptoms? I mean, I know I keep emphasizing the heavy bleeding, the painful periods, but there are some other symptoms of endometriosis, such as pain during urination and even when you're having a bowel movement. Okay. To have pain when you're using a bathroom, that's not normal. So if you notice it, please let your doctor know. Also, if you're sexually active, pain during or after sex. Now, again, some women think that a little pain during sex is normal. It's not. We need to figure out why. And again, these symptoms that I'm listing, they can also apply to other GYN conditions. So I don't want you to think that if you're experiencing this, you definitely have endometriosis. No, but these are some of the symptoms that, when we talk about the GYN and the pelvic area, and as women, we have a uterus and we have all of the things, some of our symptoms are going to be the same, even if there's different reasons. Okay. So besides the pain during sex, besides the pain while using the bathroom, you can also get a lot of bloating in your belly, and they do have a name for it. They call it an endo belly, which I wasn't even aware of. And also, if you notice that you're having difficulty getting pregnant, if you've been trying to conceive and you have not been able to get pregnant, and you're also noticing that you struggle with some of these other issues, you may have endometriosis. So can we prevent endometriosis? There's really no guaranteed way to prevent it. However, we can also try and reduce some of those risk factors I've named. And again, the risk factors, we can't really control that, right? Like we can't control our family history. We can't control if we start our period at an early age. We can control when and if we give birth, but it's not really too much that we can prevent because the risk factors are very vague. But there are some things that we can try to do to manage those symptoms. And this is why it's important for you to listen to your body, for you to say, okay, I have always struggled with really bad periods. I always thought something wasn't right. Maybe you have been trying to conceive or have a baby and, it's not as easy as you thought it would be. These are things that we can do to try to manage some of those symptoms. So we can try to maintain our hormone balance with a healthy diet and lifestyle. And I know that that's so generic, right? I mean, we say that for everything in healthcare. Oh, eat right and exercise. But it's really important, okay? There's a lot of things that, not that it could be prevented, but there's a lot of things that we can manage a little better when we're in a healthier state. So diet and lifestyle is important for just us and our well-being, but it's also important so that when we do have medical conditions, we're better able to manage it. Another way we can try and manage the symptoms is, again, staying active, okay? Because staying active when we're exercising, that will reduce some inflammation. We can try to eat an anti-inflammatory diet. So omega-3s, which we can find in fish, for instance, like salmon. Leafy greens. So making sure we're doing a lot of leafy green, like salads. And if you like kale, or if you like, let's say, like greens, like collard greens, like making more of those meals or using those as your veggie options. And also turmeric. And I know turmeric is something that some people use as they put it in their food, like they season their food or put it in their food. So that's good for a lot of different things. And I also learned that it's good for managing symptoms of endometriosis. And lastly, as I mentioned, talking to your doctor, okay? Making sure you have a doctor that listens to you, making sure you feel comfortable, you feel safe, you don't feel like you're being silenced or being made to feel crazy. Because some doctors will tell you what your options are, and some options could include hormone therapy. And I know there are some women that may not want to do any extra hormones. But again, if that's a conversation you and your doctor have and you feel comfortable with it, please explore that, because it will help manage the symptoms of endometriosis. So while there's no cure for endometriosis, there is treatment that the doctor can suggest to try and improve your way of life, because being in pain every month, or, really getting anxious about when your period is coming because you're going to bleed heavy, because you're going to be uncomfortable, that's not a good feeling. So we definitely can do things to try and alleviate some of those symptoms. So some of our options include pain management. So taking medications, which we call NSAIDs, and I'm going to see if I remember my nursing brain. I'm going to try to, get this. So NSAID, which is spelled NSAID, stands for non-steroidal anti-inflammatory drugs. I think the D is for drugs, I think. So yes, those are your medicines like ibuprofen or naproxen. Okay, those are drugs that are a little stronger than, I would say, like a Tylenol. Okay. And it's not a steroid. It's not a narcotic. It's not, we're not going into, our Percocets and nothing like that. These are more so like day-to-day drugs we can take, like ibuprofen, and some doctors may suggest naproxen. We can do heat therapy for if we have really painful menstrual cramps. So getting yourself a heating pad. Even lifestyle changes, as I mentioned, eating better, exercise and moving our bodies, drinking more water, limiting our alcohol use, and even with carbs, making sure we're limiting our carbs, because as we know, carbs can cause us sometimes to bloat if we're doing like a lot of breads and stuff. So just again, trying to adjust our lifestyles a little bit so that way we're not adding on to the symptoms that we're already going to have possibly from endometriosis. So some other treatments or ways to manage this would be hormone therapy, such as birth control, a hormonal IUD, or even a GnRH medication. And I'll spare you the details of what that is, but that is also an option. And again, your doctor will let you know what's best for you. As I mentioned before, on Well Jawn Wednesdays, when I speak about these topics, this is general information, okay? Because I want to educate you all on what this is and have you reflect on your situation and see if you suffer from some of these things that we discuss. However, I always want to encourage you to go to your doctor, either your primary doctor, or let's say you have a GYN doctor who you feel safe and comfortable with, to talk to them about your situation, because hormone therapy isn't always an option for people. The pain management, like the NSAID drugs or the GnRH drugs, those aren't always options for people. So it's up to you and your doctor, and also what you feel comfortable with. One of the biggest things that I want to mention is advocating for yourself. Please do not let a doctor or a nurse practitioner or whoever tell you what your treatment is going to be. If you don't understand it, if you don't feel comfortable with it, you say that, and be strong and silent and saying, I don't understand what you're saying. I want to get a second opinion, or I don't want that option. What else are my options? Because a lot of times we assume that we have to go along with whatever the provider is saying. And sometimes it's good to be compliant, right? Like if a doctor is making a good suggestion, it's important for us to be compliant. However, we have to be comfortable with the plan. We have to say, okay, doctor, if you want me to take the medication, could we try to do a trial run? Could we do it for 3 months? Don't give me a prescription for the next year and say you got to keep taking it. No, can we do a little trial period? And this is why with Well Jawn Wednesdays, I want to encourage and empower you all to take charge of your health. And I said it like 10 million times, and I'll say it again. It's important for you to get a doctor that you're comfortable with, because your primary doctor, which is normally your first point of contact, they have to listen to you. They have to know you. They have to say, okay, I know she may not like hormones, so let me see if we can prescribe something else. And this is why that relationship is so important. And also consistency and going to your doctor's appointments are good. This is why your annual checkups, you have to do them, whether it's with your primary, whether it's with your GYN, because it's building that rapport with your doctor before something happens, right? If I'm seeing my doctor every year, they're ordering my blood work, they're making sure I'm okay elsewise or otherwise, and I say, hey, Dr. Smith, I noticed that now I'm having this. We already have some documentation on what my baseline is. I'm not coming into the doctor when I have this full-blown problem and now we have to try and get it under control. That's not the best thing to do, okay? So try to build a rapport with your doctor. And like I said, if you have health insurance, use it. The other two options we have for treatment and managing endometriosis is sometimes surgery. Sometimes a provider may recommend something called a laparoscopy, and that will remove some of the growth of the that tissue that we talked about. Again, may not be an option for everyone based on where this tissue grows, because it can grow kind of all over the place, but surgery may be an option for you. And lastly, if you have endometriosis and it's causing you to not become pregnant, so you're infertile, they can give you fertility treatments, okay, to try and make you more likely to conceive. So this is why it's important for us as young women, and not even always so young, to check in with ourselves about our GYN health and what's going on with us. So that way we know what our options are, and we're not hopefully getting to a place where we have limited options because we waited too long to talk to the doctor about it. So why does this matter? Why is this important to me? The first thing is important because March is Endometriosis Awareness Month, right? Every month, I don't know if you all knew, but there's normally there's a health topic that's related to that month. So January, we talked about cervical cancer. February, we talked about heart health, such as like heart disease, but high blood pressure, high cholesterol. And March is Endometriosis Awareness Month. And as I mentioned earlier, me working in an OBGYN office, which I loved working with women, because we're so complex. We have so many things about us that make us unique. But endometriosis was so common. Endometriosis was common and fibroids was common. And we'll talk about fibroids because as Black women, if you're a Black woman, we struggle with that at a very higher rate than other races. So that's definitely a topic that we'll touch on. But yes, endometriosis matters because a lot of women just assume that because they bleed heavy or because they have just terrible period cramps, that's normal. Like, oh, well, this is what everybody complain about, the cramps and the bleeding. But no, if you feel like your pain is unbearable every month, that's not normal. And we have to be able to say, now that I'm thinking about it, I do want to just figure out if it's something more. Again, if you get the scans done, because that's another thing with diagnosing it. A lot of providers they'll do a cervical exam. They'll go in and they'll feel around. Of course, they'll evaluate your symptoms, but a lot of these providers will also order testing, whether it be ultrasounds. Sometimes, depending on the situation, it may be MRIs, like depending on, again, how severe it is. But there is testing for us to check and see if this is your situation. And of course, if everything comes back normal, that's good, right? I mean, that means endometriosis could be checked off the list, but that doesn't mean that it may not be something else going on. So this is why it's important for you to just really evaluate what you're going through, or even if you have a loved one, a friend, a sister, a cousin, whoever who you notice always struggles during that time of the month. Let them know, hey, did you ever get evaluated for this? There's also one other thing I want us to discuss, not on this episode, but in the future. It's called PMDD, premenstrual dysphoric disorder, where it's now the emotional part, because with PMS, we know normally as women, like we're not going to feel our best. We're going to be moody and all of the things. But PMDD is when we feel like it's the end of the world. And it's very common. We don't talk about it a lot, but we will be. Okay. So I just wanted to throw that out there. So if you know somebody, whether it be yourself, whether it be, again, a loved one, please encourage them to watch this episode. That way they can feel empowered to advocate for themselves so that they can go to their provider. Hopefully they have one that they feel safe with, who can now say, okay, I never thought about that. Because you all, I'm going to be honest with you, providers don't always have the answer sometimes, okay? I mean, yes, we trust providers to know what they're talking about, and I'm not saying that they don't. That please don't think I'm saying that. But there are some things that we may have to suggest, like, hey, can I be evaluated for that? Because maybe this is not something that provider has seen or worked with in a long time. And just, we're human, right? We're not going to remember everything. We're not going to know everything. So sometimes it does take for us to go to our providers to say, hey, can I be tested for endometriosis? And hopefully you have a provider that makes you feel comfortable enough to do that without making you feel like, oh no, I shouldn't have said that because they are the doctor or they are the nurse practitioner. No, we are human beings. We can advocate for ourselves. Yes, we trust the professionals, but the professionals are humans too. So I want you all to be encouraged. Have you dealt with endometriosis? Do you know somebody that's dealt with it? Please feel free to leave some information in the comments. Please reach out to me personally if it's something that you're struggling with. Again, my virtual door is always open, okay? Because I know that some of the things that we discuss are not always easy to talk about or easy to explain. And I'm someone who, we don't need to use the big words, okay? Just because I'm a registered nurse does not mean we need to really get into the medical terminology, and it's not important to me. What's important for me is to know what you're going through and how to best direct you to where you need to go in terms of getting help for whatever that condition may be. Okay. This is what I do and I love doing it. So please utilize me as much as you need to just try to get a handle on what it is that you may be struggling with. Okay. So I think that might be all we have today for endometriosis. Okay. I think that was plenty of information. As we discussed, it's something that is not really preventable. It's not really treatable. It's not a straightforward cure to it, but we can manage our symptoms. And managing our symptoms starts with talking about our symptoms, right? So now we are going into one of my favorite topics or favorite segments, Tea Time with Ty. Okay, we're going to get into some Tea Time with Ty. And our tea time today is very relevant to what we just discussed. And the tea time topic is, why do doctors dismiss women's pain? Why do they do that? And it's not only male doctors that could do this. And again, I'm not just talking about doctors. I really should have said, why do providers dismiss women's pain? Well, medical gaslighting, it's a real thing. It's a real thing. And when it comes to us as women and our reproductive health, it happens a lot. There's a lot of women with endometriosis, fibroids, PCOS, and other conditions, and they're just told, oh, it's just bad cramps, no big deal. Or you're overreacting. I mean, every woman goes through that every month, girl. Or even, it's normal. Just take some ibuprofen. Just take some medicine. You'll be all right. But the truth is that women's pain is often downplayed a lot in healthcare. And I'm not going to get on this too much, but women, especially Black women, do have a higher rate of dying in labor because their pain and their symptoms and what they're going through is dismissed. And there's also this thing in healthcare, it's not said necessarily, but it's felt, where it's a thing where they think women, especially Black women, we don't feel pain. Or because we're able to kind of keep a more composed demeanor while saying I'm in pain, it's like, oh no, she's not in pain. Or maybe she just wants some drugs. Maybe she just wants some medication. So medical gaslighting is real. And this is why I just want everybody that is watching this to say, you know what? I'm advocating for myself. I may not know what I'm talking about half the time, but I know what I'm going through, and I need a doctor that's going to listen to me. So because of the medical gaslighting, it leads to years and years of just dealing with unnecessary suffering. I mentioned in the beginning, for endometriosis, normally it takes women 7 to 10 years to get diagnosed. That's too long. That's too long to be uncomfortable. Periods already are uncomfortable. And we're not even talking about with someone that may have endometriosis or fibroids. Periods are not fun. And for the men out there, they're not fun. Okay? So imagine now you have something on top of your regular period that's making you be miserable. And another thing, when we bleed very heavy, we're losing iron. Iron is one of the necessary things we need for our bodies and our cells to be oxygenated. So if you're feeling very tired after every period you get because you're bleeding heavily, you need to get your iron levels checked, honey, because we can't let that drop too low. So if you notice again that you have heavy periods, you're bleeding a lot, cramps are terrible, and you're also going through times where you're like, I can't even stay awake, you're losing a lot of blood. And it's not being replenished. Okay, so please make sure you're going to your doctor, not only about your GYN symptoms, but asking for blood work to make sure that your iron levels, your CBC, which is your complete blood cell count, is good. So I want y'all to spill the tea. I want y'all to let me know, has a doctor ever dismissed your pain, or a provider? And also, what did you do? How did you handle that? Or do you currently feel as if you're going through something where a doctor or a provider is dismissing your pain and you feel very uncomfortable about it, or you just feel lost? Please let me know in the comments. And again, please reach out to me personally, because I want us to have these conversations. A lot of times we suffer in silence. We suffer by ourselves. We feel like because we don't know all of the right information that we may not know how to talk about it, or whatever the case may be. But we don't need to know all of the information to know that something is wrong. Okay? So ladies, that is all I have for today's episode of Well Jawn Wednesdays. I hope you all learned a little bit. I hope you feel empowered to advocate for yourselves, as well as your children or your nieces or your sister, even your mother, somebody who you know is the strongest person you know, and they just suffering. And they just like, oh, it'll be all right. I'm going to take a little medicine. I'm going to put my little heating pad on and take a nap. No. Advocate, send this episode to them if you feel like it applies. But just in general, the overall theme is advocate for yourself and for your health, because you deserve to feel okay. Okay. Nobody deserves to suffer in pain for years and years. There's chronic pain. There is a thing where, again, some doctors may not always be able to figure out why. But in other cases, we just need to be able to verbalize what we're going through, and also find providers that we can trust. Okay. I'll see y'all next time. Please take care. Be well. Bye.